Chairman, dear ladies and gentlemen. So, what do women want in breast reconstruction? Age-tiered surgery or rejuvenation. This was a study that was kick-started with the idea to do this by Arup Ray. Arup Ray was my senior mentor and supervisor at the Kensburn Glasgow Royal Infirmary, Kensburn Plastic Surgery Unit. So I'm a plastic surgeon, and I trained and worked for several years at Glasgow Plastic Surgical Unit as a locum and later as a consultant plastic surgeon. And basically I'm from Hanover, where I currently work since 4 years at the Medical School of Hanover. Plastic Surgical Department is a big university hospital and German plastic surgical department. So it's a kind of conjoined study. And because it's late in the day, I try to make it a little bit entertaining and not so dry for you all. So if I would ever know what a woman wants, this was a question Sigmund Freud asked himself after doing 30 years of psychoanalysis of the female soul. So, if I would ever know what a woman wants, well, what does a woman want? The aim of this study was the investigation of desires of women in breast reconstruction. So we put this question on a little bit smaller scale to not make it too complicated. The method. We asked simply, what do you want? Yes, simple go and not assume the doctor knows the needs of the patients we have heard here during this conference. Well, do not assume you know, just ask. So we posed a questionnaire once, an online questionnaire, which actually was a clever idea of my co-author, Julia Reinke, who's a registrar in our department, and an offline questionnaire. And by this two means, we targeted a younger and older women's group because the online group was rather young, as it turned out to be. Questions desired in the desires of women in breast reconstruction. And we said to the women, please put yourself in the imaginary situation of being diagnosed with breast cancer, and then please tell us, what would you want? On purpose, we did not target actually breast cancer patients, because these ladies can be in a big situation of shock, of being out of the normal frame of thoughts, and they are also advised by their surgeons. So what they want might not be actually what they truly want, but what might be also coming out from a consultation. So the two optional choices the groups of women were posed. Option one was they could choose or desire a reconstruction unilaterally, just on the side of the breast cancer, on one breast basically, and to create the former natural own ptotic breast shape that they had. And the ptotic breast, for all the non-surgeons, ptosis is what is called the natural hanging of the breast. So every woman of a certain age, like starting from late puberty, is under the influence of earth gravidity. And earth gravidity is not very kind to women's breasts because it just brings it down. And by skin stretch, the breast comes down. And this natural hanging is called the ptosis of the breast. So in essence, it's a kind of early sign of aging, but it's just the natural woman's breast shape. And option two was to do a reconstruction on both sides of the breast bilaterally, of a lifted, rejuvenated breast with less skin access. And, but this would then usually require, if you lift the one breast up, the one with the cancer, you would later, for symmetrization purposes, also do breast surgery on the healthy breast. So you need a contralateral surgery in this case. Why we did pose these questions? Because on plastic surgical conferences, still big discussions are going on if the creation in breast reconstruction should really be a ptotic breast shape, or if the ptotic breast shape is not considered to be less beautiful. So all these surgeons keep on and on and on about the idealized breast and how you can measure and how it would look and where the nipple should be and how much percentage of the breast tissue should be above the nipple and below the nipple. And they go on with linear measurements and back and forward the ideal breast. So the aim in many opinions of plastic surgeons in breast reconstruction should not be to create a ptotic breast, because that's the older aged breast. So it's actually still in the discussion. So now I give you 2 examples to make that visible. So here on this side, here is actually a breast which is reconstructed with a free deep flap. So we have heard a wonderful talk about the free tram flap. And it's basically a very similar procedure. DEEP is a deep inferior epigastric artery perforator flap. It's more or less the same, just by doing the same as the lady before explained to us, but not using the muscle, just creating the vessel out. And with that flap type, you can create a lot of skin access. So in fact, you can recreate, by doing this flap, a ptotic breast shape. But of course, this is a hanging breast, like in a normal aging woman, how the breast would look like. In fact, however, most breasts turn out like on the other side. They're kind of lifted because we do not create in normal breast reconstruction enough breast skin access to create this level of ptosis. So automatically, in breast reconstruction, we often end up with a lifted, pacted breast shape on the involved side with the cancer. So now, back to my questions. I just want to read them out to you because we were thinking a little bit about the wording, how we put that, not to influence any answers. So option 1 was, do you want to look the same as before and get a reconstruction matching as closely as possible the previous shape and symmetry and restore the body as it was, even if you did not have perfect looking breast? Or option 2 to choose, do you want to take the opportunity to look aesthetically ideal with new breasts with perfect shape and symmetry and change in order to achieve this goal, also the healthy breast, which otherwise would not need an operation? Now, the results in the online group. The online group turned out 262 women, which were rather young, about 27 years. And from this young ladies group, 183, which is 70%, chose option 1. So only the operation on the breast that actually had the cancer. Only that should be recreated. And 30% chose option 2. They wanted a lifted and nicer looking breast and wanted also surgery on the other side. And I put this, or my colleague, Julia Reinker, who was co-author here, she put that on surveymonkey.com. So that is just a platform. It's actually a commercial platform. And if you're a researcher and want to pose questions on a larger scale, you can put your questions there. I have actually no conflict of interest with that, but I didn't know about that. It was quite interesting. The only thing for me, I felt it was a bit confusing to understand the results because some of the percentages I couldn't quite understand. And so I printed all the results out and counted them through by hand to double check. And I figured just out later that the answers actually the surveymonkey.com gave were correct, but they came together because some women online did not fill out all the boxes. So there were some blanks, and so some small variation in the percentages occurred. So now this is how it looked like. You don't need to read that all. So I asked for age group, breast sizes, bra sizes, and family of breast cancer. My online group. I asked some other things like but they had no correlation together. So my offline group. So I thought 27 years of mean age was a bit young. So I wanted to ask the older women too. So I printed a classic paper print-out questionnaire and distributed that to any woman kind of age 40 plus roughly and said, give it to your friends, or just so like this. And all of them come back to me, 110 women and mean age 53 years. And again here, now option 1 was chosen in 76% of women. So 76, 3/4 chose option 1. Now this looked like my offline group with bra sizes, etc. And the offline group, I asked also for desires of symmetry. And my offline group said, well, about, 23% said we want excellent symmetry after the surgery. and 76.5% said we want good symmetry. So they had to tick a box. How should the symmetry come out? Excellent, good, fair, or poor? And so it was in between excellent, good, but interestingly, the majority said good symmetry, not excellent symmetry, which is interesting because symmetry is considered as a sign of beauty. So, results: 2/3 of the younger and 3/4 of the older women desire unilateral natural ptotic breast reconstruction. No desire for contralateral surgery. Women want their own form of ptotic breast back. No desire for rejuvenation and unnecessary surgery. And the women desire good rather than excellent symmetry. So, with all the questions, what it was out, women with a family history of breast cancer and smaller breast, as well as women of the older age, even more frequently opted for the option 1 for only the unilateral ptotic breast reconstruction. And the only exception were younger women with larger breasts. They had slightly more percentages on option 2, looking also, desiring also contralateral adjusting surgery, which is understandable. If you are like bra size D or plus, you might have thought about a reduction surgery anyway in the past. So, conclusion: breast reconstructive surgery should aim to recreate the own patient's former breast shape, even if it was ptotic and with skin access, and it should try to avoid contralateral adjusting surgery overall as a goal. And that was it. Thank you very much.
Okay, that's the last presentation of the day, and I want to thank you all for